Hi, this is an overview video that shows how you can review patient data on the Insight Addiction platform. When you log into the Insight platform, you'll see a list of all of your current patients. If you want to view any patient data, just click on the patient's names and you will see the information about the patient. The black bar on the left of the charts is how they reported feeling in the 30 days before they began treatment, and then you can see how they've been improving during the time that they've been in treatment. There'll be different graphs for all the different conditions we're monitoring them for. This could include depression, anxiety, trauma, and eating disorders. We'll also follow any suicidal thoughts and self-harming behavior. And then once they're in treatment, we'll track whether they've been using drugs or alcohol, the strength and frequency of their cravings, how they're getting along with their family members, if they're in outpatient treatment, how many days per week they've been attending treatment, and how satisfied they are with treatment. If you want to save a report of this, all you have to do is push Generate PDF, and then a report will be issued that you can save or print out. You will notice that some of the patients have flags next to their name. This indicates that their most recent survey reported dangerous levels of suicidal thoughts or self-harming behaviors or drug and alcohol use. Another neat thing is that if you have any questions about the data, for example, in this case, this patient has a possible binge eating disorder. Perhaps you'd like to know exactly what type of behavior he was reporting. You can go to the Data Submissions tab, click on the survey you want to see, and then see exactly how he answered every question. In this case, the patient said that in the month before starting treatment, he ate an unusually large amount of food and experienced a loss of control about 10 times per week. And during these episodes of overeating, he ate more rapidly than normal, ate until he felt uncomfortably full, and ate large amounts of food regardless of whether he was hungry or not. Another thing we can do is to get a quick overview of how your patients are doing in the group summary report. This shows the most recent data point for each patient as a function of how long they've been in treatment. And because we label the data points of any patients in the yellow or red zone, you can look down this group summary and you can see the names that are appearing over and over again and determine that perhaps in the next few days you're going to pay particular attention to Tracy and David and perhaps Derek, who's one of your brand new patients. When you have a new client, the first thing you'll want to do is to enroll them in the research. Go to the Survey Links page and then click on New Client on an iPad or laptop that you can then hand to them, and then they will be taken to a questionnaire where they would give their permission to be part of the research, and also, if they're adults, be taken directly to the intake questionnaire. Once your patient has enrolled in the Insight survey, then there will always be a line for them with their name on the survey link page that will take them to the next survey and will show you when they last completed the previous survey. You have several options here. If they're in residential treatment and do not have access to email or text, then you'll probably want to continue to use an iPad or a laptop to have them take the survey. However, if they're outpatient or otherwise have access to the internet, what you can do is click on Make Request and we will send an email or text to them asking them to take their next survey immediately. Alternatively, what we do for a lot of our clients is we send out a weekly request usually on Sunday afternoons, to all patients for whom a new survey is due, asking them to take them so that you would have the information first thing on Monday morning. If you have any questions or problems with the Insight platform, please give us a call or email us. We hope that you enjoy using the platform and find Insight very useful for your clients. Thank you.